everyone, Luke here with a quick presentation on asthma. So, asthma affects around 2.5 million Australians, and in 2014, 419 Australians lost their lives from asthma attacks. Now, that equates to around 8 Australians each week die from an asthma attack. Now, when you're looking at the definition of asthma, it's a breathing disorder which affects the smaller airways, which are known as the bronchioles, in the lungs. And it's usually characterized by wheezing and chest tightness and a shortness of breath. Now, one of the major events which happened in Australia in terms of asthma was in 2016, and this was known as the thunderstorm asthma epidemic, and it happened in Victoria. Now, 10 people tragically lost their lives, and they were aged between 18 to 57. So they were at a fairly strong point in their lives. They're not overly young or overly old. Now, there's two different types of medications that we look at with an asthma attack. There's a reliever medication and a preventative medication. The reliever medication is for when you're having the attack or possibly before you exercise. The preventative puffers or medications are used, generally speaking, in the morning, and they're used to prevent an attack from occurring throughout the day. Now, the reliever medication is what we're going to mainly focus on today. That's a blue puffer, and you'll see those in the first aid kits at schools and all sorts of places. Now, the two brands are called Ventolin and Asmol, and the drug is known as salbutamol. Now, you can buy these over the counter at the chemist. Now, if you're using the reliever medication, so salbutamol, more than twice per week, except for before when it's exercise, before exercise, you can take a few puffs. It's suggested the person needs to get a preventer medication as well. And the aim is then you won't have to use your reliever medication as much. The other thing I want to talk about is the treatment. So I'm going to post a link for a video from Asthma Australia, and that will detail the treatment very well. Now, the other thing that you're looking for there is the 4x4x4 method. Also, that video will go through the spacer as well. So there's different stats that go around, but around 50 to 60% more salbutamol gets into the bronchioles and the lungs just by using a spacer. So it is critical. Now, the triggers, we spoke a little bit about this in a previous video, but allergens is probably the main one. So dust and pollens, that sort of thing in the air, or it could even be in the carpet as well. Cold air is also another big trigger. So usually during winter, people get more asthma attacks. Certain drugs like medications, I know aspirin's one that could potentially cause a asthma attack. And you can go right down. Actually, another interesting one is people's jobs. So let's say they're working with chemicals. There can be chemical dust in the air, and that can essentially cause an asthma attack. Now, if possible, remove the casualty from the trigger before treatment. Now, the symptoms, we went through a few of these before. So shortness of breath is your main sort of obvious one. Wheezing is the next one. So it's usually known as an expiratory wheeze. So when they breathe out, it's like they're breathing out through a straw, and it makes like a hissing type noise. Chest tightness is another common symptom. As you can see in the diagram off to the right there, you've got a normal bronchial tube. The center picture is someone with asthma who is not currently having an attack. And then the far right is the asthmatic during the attack. So you can see how there's a constriction there through the bronchial tubes. Severity. So if someone's speaking, they're breathing. That's the easiest way to think of this. So if you can put a full sentence together, your condition is quite mild. If you're unable to speak, your condition is severe. And in that sort of case there, that's pretty much when you want an ambulance almost immediately. So you need to call 000 immediately. Now, the treatment, like I said, the video I'm going to post is going to show a good demonstration of the treatment, but purely verbal, all you want to do is shake the blue puffer. So the blue puffer, remember, is for when they're having the attack. So if someone's having an attack, you pick up the blue puffer, you could give it a good shake. The second thing is you prime the puffer or the medication. So you put one puff into the air, and that primes the medication. You then grab the spacer, put the puffer in the back of the spacer, and you put one puff into the spacer. The person wraps their lips around the spacer and they take 4 deep breaths, essentially sucking the medication out of the spacer. They then repeat that process 4 times. So it's 1 puff, 4 breaths, 4 times, and they can repeat that process every 4 minutes as required. Now, after 2 doses of that medication, so they've had 8 total puffs, if they're not improving after that, you definitely need an ambulance and you will need to call 000. Now remember, the drug name is called salbutamol. The 2 brands you can use are Ventolin or Asthmol. In schools and childcare centres, if there's children or students who have asthma, they get generally given a plan which is written by the doctor, and the children's teachers are told to adhere to that plan as best as possible. So you'll see these around in childcare centres and schools. Hope that was interesting. Thanks for watching, and I'll talk to you next time.